Sometimes a strengthening session is not actually the issue. It may be the strengthening session plus the grocery store, plus stairs, plus standing in the kitchen for 2 hours afterward that pushes the total workload too high. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you've had a knee replacement, have you ever noticed how one really good day can suddenly turn into 2 frustrating days afterward? You finally feel capable again, so you walk farther, stay on your feet longer, maybe add extra strengthening exercises because you're motivated and ready to move forward. Then, the next morning, your knee feels swollen, stiff, irritated, and heavy, and suddenly you start questioning whether you've pushed too hard, even though you were trying to do all the right things. By the end of this episode, you'll understand how to build strength after knee replacement without getting trapped in the cycle of doing too much, backing off completely, and losing consistency. This is the 3rd episode in a 4-part series on strength after knee replacement, where we've been walking through how strength changes movement, balance, confidence, walking tolerance, and long-term independence after surgery. This boom and bust pattern shows up frequently after total knee replacement because even when strengthening is explained, many people do not fully realize how important dosage and pacing become once real-life activity starts picking back up. Many people enter surgery after years of moving less, avoiding stairs, changing the way they walk, and gradually losing strength. Then after surgery, they're suddenly handed exercises, walking goals, step targets, and expectations to become active again, often without a realistic understanding of how quickly too much activity can accumulate across an entire day. A lot of people struggle to figure out how hard strengthening is actually supposed to feel after knee replacement. Some people become very cautious because they're afraid of irritating their knee, while others push aggressively because they assume more effort automatically leads to faster strength gains. In reality, the most productive loading zone usually sits somewhere in the middle. Your muscles and surrounding tissues need enough challenge to stimulate change, but not so much that every session creates a major flare-up that wipes out the next several days. That's where learning the difference between productive soreness and true overload becomes so important. Some temporary soreness, heaviness, or stiffness can happen as the muscles and surrounding tissues begin tolerating gradually increasing amounts of load over time. The harder part is recognizing when your knee is simply responding to new demands versus when the overall workload has exceeded what your body can currently handle. And that distinction becomes very important after surgery because strengthening requires repeated exposure to load. Muscles adapt when they are asked to do work slightly above the current comfort zone. Building strength requires enough consistency and enough challenge for the muscles to gradually tolerate more force production over time. And there are also situations where your knee may need more attention instead of simply a lighter day. Mild muscle fatigue, temporary stiffness, or slightly heavier feeling for several hours afterward can happen as strength work progresses. But sharp, escalating pain, rapidly increased swelling, spreading redness, fever, drainage from the incision, calf pain, sudden shortness of breath, significant limping, inability to bear weight, or a sudden loss of motion should be discussed with your surgeon and healthcare team. Signs and symptoms that could suggest infection or a possible blood clot should always be evaluated promptly by your medical team. Normal soreness can feel very similar to an injury signal when you have been through surgery and you're trying hard to protect your knee. This is often when people start pulling back from their exercises, walking less, or becoming hesitant to load their knee for a few days. Then once their symptoms settle down again, they try to make up for lost time by doing a lot of activity all at once. Over time, that repeated shift between backing off too much and suddenly overloading your knee can make it harder to build consistent strength and activity tolerance. Research looking at rehabilitation after total knee arthroplasty continues showing that consistency often produces better long-term strengthening outcomes than dramatic effort. Large analyses involving more than 12,000 randomly from visit to visit. Randomized trials of progressive higher intensity rehab after knee replacement have also reported better strength and functional performance when the program is supervised, individualized, and advanced appropriately. That almost sounds like they're contradicting each other, but they're really not. They're saying that consistency is important, but you also need an individual program. So working with a physical therapist on that becomes extremely important. So before changing anything, I think it helps to take an honest look at what is actually happening across your days right now. Not in a judgmental way and not as criticism toward yourself, more in a sense of becoming a careful observer of your own patterns. A lot of people start noticing things they had not fully connected before. They notice their knee feels worse after stacking too many demanding activities into one afternoon. They notice they tend to push harder on good days because they're excited to feel normal again. They notice they become more hesitant after a flare-up and start pulling back more than necessary for several days afterward. And that kind of self-observation is useful because it helps you respond more specifically instead of emotionally. And it also helps people become a little more patient and kind with themselves during a process that asks for far more adjustment than most expected. So what can you actually do when you notice yourself getting stuck in this boom and bust cycle? Number 1, change only one thing at a time. If you increase walking distance, do not also dramatically increase strengthening intensity, stair activity, yard work, and errands in the same couple of days. Give yourself a chance to see what your body is actually responding to. Don't be in such a rush. You've got time. Number 2, pay attention to delayed responses. A lot of people feel fairly good during activity and only notice swelling, heaviness, or stiffness later that evening or into the next morning. And that delayed response often tells you more about your current tolerance than how you felt during the activity itself. If you consistently feel significantly worse the next day after certain activities, that's usually a sign that the overall workload needs to be adjusted instead of continually pushing through. Number 3, think in smaller increases with strengthening. A lot of people assume strength only improves if they dramatically increase resistance or push until they're exhausted, but that usually backfires after knee replacement. One additional set, slightly more resistance, a lower chair for sit-to-stands, or one extra stair repetition may already be enough challenge to begin building more strength. Many people do better progressing repetitions first, then building toward 2 to 3 sets before increasing resistance gradually. The same idea can apply to other activities too. If stairs, errands, or longer periods on your feet tend to increase soreness afterward, smaller increases are usually easier to tolerate than sudden large jumps in activity. Number 4, do not interpret every flare-up as a sign that strengthening needs to stop completely. Sometimes the adjustment is simply reducing resistance temporarily, decreasing the number of sets or repetitions for a couple days, spacing strengthening sessions out differently across the week, or giving yourself a lighter strengthening day instead of a heavier one. And number 5, start looking at the full day instead of individual exercises. Sometimes a strengthening session is not actually the issue. It may be the strengthening session plus the grocery store, plus stairs, plus standing in the kitchen for 2 hours afterward that pushes the total workload too high. Activity accumulation adds up quickly after knee replacement. One reason strength gains can be hard to recognize at first is because they usually show up in everyday movement before they feel dramatic during exercise itself. Strength building after knee replacement often starts looking like standing up from a slightly lower chair more comfortably than you could a couple of weeks ago. It looks like climbing stairs with less reliance on the railing and feeling less fatigue in your legs during normal activities. Stronger quadriceps help with standing up, climbing stairs, controlling descent, walking longer distances, and tolerating more activity across the day without your legs fatiguing as quickly. Early strengthening after knee replacement is often less about heavy resistance and more about learning to control movement well during functional activities. Sit-to-stand, step-ups, controlled stair work, and walking mechanics all help rebuild force production and movement control before heavier loading is introduced. As healing progresses, strengthening usually shifts more toward progressive loading, and that may mean gradually increasing repetitions first then building toward 2 to 3 sets and eventually adding small amounts of resistance as your movements become easier and more controlled. If you're unsure when it's appropriate to begin progressing resistance more aggressively, I shouldn't say more aggressively, begin progressing resistance a little more, that's an important conversation to have with your physical therapist or surgeon. Usually we don't do anything really aggressively. For many people, more traditional progressive loading begins somewhere around 6 weeks after surgery, or sometimes a little bit later depending on swelling, pain levels, movement quality, and overall healing. If you do have a flare-up, it does not mean that the strengthening itself was a bad idea. Sometimes the adjustment is simply reducing intensity temporarily instead of abandoning strengthening altogether. You might reduce resistance, lower the number of sets or reps for a couple of days, or give yourself a lighter strengthening session before building back up again. It's also important to give yourself rest breaks after strengthening because you actually need that recovery. Strength progression is rarely perfectly linear after knee replacement. Sleep, swelling, stress, overall activity levels, and soreness can all influence how your body responds from one session to the next. Some health conditions can also influence how quickly strength returns after surgery. For example, research has shown that people with diabetes may take longer to rebuild strength and physical function after knee replacement. And that doesn't mean that they won't rebuild the strength. It just means it might take a little bit longer. That becomes important when people start comparing their progress to somebody else's. And that's one reason comparison becomes so dangerous after the surgery. Some people tolerate higher levels of strengthening or stair work fairly early, while others still need more time building back their baseline strength and activity tolerance before progressing further. Different people respond to strengthening at different rates depending on pain levels, swelling, baseline strength, overall health, activity history, and how their body tolerates loading after surgery. Another important concept here is capacity. Capacity is essentially your current ability to tolerate physical demand. If your current strengthening capacity is 2 sets of sit-to-stands, step-ups, and light resistance work, suddenly doubling the workload may temporarily exceed what your body can currently handle, and that could be a slight setback. Doesn't mean you ruined anything. It just could be a setback. You need some more rest. People sometimes interpret that response as proof that something's seriously wrong. Especially after going through a major surgery, they might think, I knew something was wrong, or I damaged the implant, when often the tissues were simply overloaded beyond current tolerance. The solution usually is not complete inactivity. It's usually, or often, adjusting the dosage a little more specifically. You got to dial it in. That's what physical therapists can really help you with as well. And this is where tracking can also become incredibly useful. You don't need a complicated spreadsheet or a sports science laboratory, a simple notebook where you record walking duration, strengthening exercises, soreness levels later in the day. You might even record swelling patterns if that's an issue that you have. Sleep quality is important too, and that can reveal very predictable patterns over time. Many people are very good observers once they start paying attention systematically. They begin noticing that certain exercises feel better when performed every other day instead of daily. And if you're doing some progressive loading, you really should be giving yourself a day of rest afterward if the load is high enough. People notice that adding too many strengthening variables at once creates more soreness afterward and can tend to just fatigue you and not actually build your strength. This is where guided progression can help tremendously. Physical therapists are not only prescribing exercises. Good rehab professionals are constantly adjusting dosage, intensity, frequency, exercise complexity, and movement quality based on how each person responds. Research looking at outpatient rehabilitation after total knee arthroplasty also emphasized that rehabilitation should remain individualized because people have different goals, different lifestyles, different medical histories, and physical demands after surgery. Community can also play a bigger role here than many people realize. When people hear others describe similar flare-ups and similar strength plateaus, they start recognizing patterns that are actually extremely common after knee replacement. And if this episode helped you understand a little more about strengthening after knee replacement, make sure you're signed up for the Total Knee Success Insider newsletter. I share ongoing education and support there so you can continue receiving helpful information at the right stage at the right times. Sometimes having the right explanation at the right time changes the entire experience. And if walking is one of the areas you're working on right now, I also put together a free resource called Top 10 Walking Tips After Knee Replacement. You can grab it through the show notes or by visiting totalkneesuccess.com. Before we finish today, I want to leave you with one final perspective. Strength after knee replacement is usually built through consistent, progressive loading, not occasional extreme effort. A well-dosed strengthening session repeated consistently over time often accomplishes far more than dramatic workouts followed by several difficult days afterward. And when strength finally begins building consistently, something else starts changing too. People begin standing differently. Walking becomes less guarded. Participation expands. You do more things that you want to do. The focus slowly shifts from protecting your knee at all costs toward using it again with more confidence. And that's exactly where we are heading in episode 74, where we're going to talk about when strength finally turns into confidence, how repeated successful movement experiences reshape balance and independence, why fear reduction changes mobility, and how community support often accelerates the willingness to move again. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.